What is carpal tunnel, and can you treat carpal tunnel syndrome with prolotherapy? Yeah, that's a great question. And like I do in other videos, is you got to realize there's true carpal tunnel syndrome, then there's pseudo carpal tunnel syndrome. So most folks who come to Caring Medical, they have pseudo carpal tunnel syndrome. What that means is they have the symptoms of carpal tunnel syndrome. So the symptoms of carpal tunnel syndrome are what? They have pain and or nummy feeling, a numbness kind of feeling in basically these three fingers. True carpal tunnel syndrome is when you have your median nerve that's getting pinched at the wrist right here, and then that causes the median nerve not to work in this area. So you end up getting atrophy or weakness of this muscle, which is the abductor hallucis, and then you start losing sensation in these three fingers. Okay? So if you have true carpal tunnel syndrome, in other words, this muscle compared to this muscle on the other hand is getting flattened, it's getting atrophied, it's getting littler, and you're losing muscle strength, and you're starting to get true numbness, then what it means is that the nerve, as it crosses the wrist here, it needs more room. Again, folks who come to us, they want to treat it conservatively. So the way to treat it conservatively is we have them use a C-track device. Take vitamin B6. And then, of course, if they have any sort of pain in the back of the wrist or the elbow, we'll do some prolotherapy, and sometimes I'll do neural therapy, which is basically Novocaine injections into the median nerve. So, and then of course some folks choose to get arthroscopic decompression, which is a surgical procedure where they cut the carpal ligament, and then it gives the nerve more room. Now, like I said though, most folks who come to us, they have the symptoms of carpal tunnel syndrome, but it's not really carpal tunnel syndrome. Let me give you an example. If you look at my wrist, see how it's real skinny here? I have a very, very skinny wrist. It's not a thick wrist. Skinny wrists very seldom get carpal tunnel syndrome, true carpal tunnel syndrome, because a skinny wrist has a lot of room here. Like my median nerve has a lot of room. If you have a really, really thick wrist, in other words, it's thick this way and it's short this way, you have so much tissue that kind of a wrist. So sometimes I can look at somebody and they're like, I got carpal tunnel syndrome and I want to see if I'm a candidate for prolotherapy. I can just look at their wrist and I'm like, you don't have carpal tunnel syndrome, without seeing anything else, because they got a wrist like mine. I mean, in other words, it's long here, it's short here, it's long here. So my median nerve is going to have lots and lots of room. So in that case, I got to talk to them about how ligaments refer pain down the arm. So often I'll just go like this, and then they're like this, and they're like, geez, I didn't even know my elbow's hurting. And then I'm like, well, my second question is, do you type a lot? Let's be honest, most of us have jobs. Even though I'm a doctor who does prolotherapy, every time I write articles on prolotherapy on the computer, I'm answering all my emails, communicating with staff. Most of us, even if our job doesn't involve the computer, we're on the computer, 2 hours a day. And folks who are on the computer, 8, 9, 10 hours a day, I would ask them, was the human body meant to do 10,000 keystrokes a day, or however many thousands of keystrokes? I mean, it's crazy. So the stress on the elbows and the wrist, just by computer work, or anybody who's on an assembly line and they're doing the same thing all the time, they often have elbow problems. So a person can just poke on their elbow over here, and if it is pretty sensitive and you have symptoms of carpal tunnel, you probably have pseudo carpal tunnel. In other words, you have an injury of the lateral collateral ligament or radiocollateral ligament of the elbow. There's also another ligament called the annular ligament. These ligaments refer pain down the arm to the hand. Likewise, if folks have ulnar collateral ligament injury, it can refer pain to here. So that simulates ulnar neuropathy. So you could have a pseudo ulnar neuropathy. So the treatment for pseudo carpal tunnel syndrome or pseudo ulnar neuropathy, of course, is going to be prolotherapy. So we would do prolotherapy to the elbow. Sometimes if they have pain in the back of the wrist, we do prolotherapy to the pain in the back of the wrist, and it resolves it very quickly. I would encourage people to book Prolo Your Pain Away. It goes into more detail as far as, and some really good pictures as to how these ligaments refer pain down the arm. So definitely most cases of quote-unquote carpal tunnel syndrome that we see in the office responds great to prolotherapy.